All right, well, thank you, folks. We have a wonderful turn-up today, and the numbers seem to be growing by the day as we continue to do these webinars. I'm very excited that Indu is here. Thank you, Indu, for joining me here.
My pleasure.
What we're going to do today is do a brief intro, a few slides. I'm going to hand the floor to Indu first for some introductory words and do some additional words myself, and then we will take your questions and see how far we get in an hour's time. Indu, I'll put on your next slide here for you.
Okay, thank you. So I wanted to bring you this very interesting and important topic to me. I practice in Southern California. It's been my great pleasure to work in a couple of different healthcare systems, the UCLA and the VA, and I was just getting a lot of questions around integrative medicine and wanted to learn more about it. I, in my personal life, ended up doing a lot of yoga. I have 3 children. I was trying to balance work and a career and home life with 3 boys. And so I ended up doing a lot of yoga, did a 200-hour training eventually to become a yoga teacher. Learned a lot about mindfulness and meditation over some period of time. And then I ended up doing a board certification in integrative medicine. And so I think I have a unique perspective as a Western trained neurologist who loves taking care of Parkinson's patients and also having this background in integrative medicine. There's a lot of confusion about what integrative medicine is. And I wanted to clarify that today with the first couple of slides. And then Bas will be talking about it from a different perspective as well. And then we'll take some questions. So I want to first think about integrative medicine as a way to think about other healthcare systems and integrating them along with Western approaches. So it's not instead of. And so the old term of complementary and alternative medicine has kind of gone out the window. And so we're really talking about integrating 2 different medical systems into the provision of care for our patients. So it's important to think about this in a way where integrative medicine thinks about the body's innate healing process rather than relying on a symptom and then looking for a cure of that symptom. It's really thinking about the body as being able to heal itself. And actually there's a lot of interesting areas of application for this in Parkinson's. The thought is that the mind and the body can be very resilient. And I think many of us are dealing with stressors on a day-to-day level right now and finding that a lot of our patients are really rising to the occasion. And so the hope is to sort of allow the body to use different modalities to heal itself. Another way of thinking about this is thinking about the definition by the World Health Organization, which is really the leader in the field of defining medicine in the world. And they talk about health as a state of complete physical, mental, and social well-being. And so this is very important to think about. It's not just the absence of disease or infirmity. And I think when we think about things from a Western eye, we think about, I have Parkinson's disease, I have this symptom, and it's really thinking about the person in their environment, in their home, with the people that are living around them, in their neighborhood, in their city, and really thinking about it in a very holistic approach. And so I really want to think about this as not just a supplement or something that you might add to the regimen of your Parkinson's pills, but really think about the whole approach to treating patients with Parkinson's in a very different way. And it actually blends beautifully with, I think, Bas's philosophy of thinking about teams of people that are providing care, from a physical therapist, from a dietitian, from the doctor, the nurse, this whole group of people that are supporting the patient in the middle. And also thinking about it in a holistic way where we're thinking about preventing problems from happening, from diagnosis, or possibly even moving up our diagnosis by looking at things that may allow us to get a sense of who might get Parkinson's, and drizzle in lifestyle approaches from the get-go. So thinking about things like sleep, thinking about exercise, thinking about diet. I know you've spent a lot of time in these series thinking about these approaches, but really when we're talking about integrative medicine, I don't want people to think it's going to, the health food store and buying one pill off a shelf. It's really thinking about this disease and all these different approaches that may help you with your symptoms and to thrive with this disease.
Thank you, Indu, for this perfect introduction. Just a quick reminder, we'll be brief about the book. You've seen the video in the introduction. The book is actually also dealing with integrative medicine and a holistic approach. I hope that you will all buy the book, read the book, and review the book. It's about the Parkinson pandemic that's taking place. I'm repeating myself from earlier presentations, but Parkinson's is the fastest growing neurological condition on the planet, unfortunately. And we think it's because Parkinson's is, at least to a large extent, man-made. We're doing this to ourselves. It's the pollution of the environment. It's our unhealthy diets. And we need to act and do something about it. This is all in the book. I'll be brief about that because I really want to get to the, you can order it here through this website, endingpd.org. In case you're thinking that I'm promoting my own income here, that's not the case. All proceeds go to efforts to end Parkinson's. We're donating all our money to Parkinson charities. But I think that the more books we sell, the greater the voice we jointly have in our fight against Parkinson's. And I hope that one day the promise of the book, Ending Parkinson's, will become a reality. So I'll briefly address 7 items around integrative medicine that I've called the Magnificent 7. And the first is about evidence and credibility. And Indu already said, you know, the black and white distinction between regular care and complementary or alternative medicine or integrated care, it's not a black and white distinction. It's a continuity. It's one holistic approach, to my mind. But it does circle back to evidence. And I once attended a lecture by a professor, a Dutch professor, who gave me this slide, which I felt was really important. If there is on the right hand in this curve a high credibility, you know, a new cancer treatment tested first in a small mouse and then a bigger mouse and then in a rat and then in a monkey and then a phase 1, a phase 2 and a phase 3 trial, the chance of that research finding being accepted by the community is very high. So that would apply to an oncology treatment. But swimming with whales, for example, has a very low credibility. And I think that we all agree that we should probably spend more of our time and effort towards the right end of the spectrum instead of towards the left end of the spectrum. But that's not to say that there is nonsense happening, particularly in the intermediate part of the spectrum. And this is, I think, where all the debate in the world is around. This is about interventions that people label as alternative or complementary that I feel have a certain degree of credibility, that have maybe not been studied as rigorously as a cancer treatment, but that certainly deserve that treatment, deserve that type of investigation. Here on the right end, you see now the Ldopa trial. And just to remind you, you know, this is a beautiful paper in the British Medical Journal about remote retroactive intercessory prayer to control infection. So if a priest prayed for you, the infection that happened 10 years ago would take a better course. And I think we would all agree that this is, just like swimming with whales, something that is not at all credible, and we should not be spending money on this. So this issue of credibility relates about, is there a good theory about the treatment? What is the type of intervention? How has it been measured? In what culture does it come from? And Indu already related to the differences between the Western and the Eastern cultures, and what research has been done. And just a few examples of what I think is in that intermediate realm, which I find huge. So dance has a theory, is maybe not well studied, is labeled by some as alternative or complementary medicine. I think this is a regular exercise intervention that is in need of further rigorous study. But as you can see, I'm already engaging in dance with my patients. A healthy diet is, I think, something that is an intervention that we all need to resort to, but that's been very poorly studied. It doesn't make this alternative medicine. It is regular medicine, but it's still relatively poorly studied. For example, I recommend dark fruit to my patients because they have lots of antioxidants. It's only been tested in rodents. So on the curve that I showed you, this would be still relatively on the left end. Cranberries is interesting. They acidify your urine and help to prevent bladder infections, which is important for all people with Parkinson's. And there are actually fairly good clinical trials in the field of general medicine. So this is not complementary medicine. This is a regular intervention. Probiotics, I know, has a huge interest in the Parkinson community now. And without going into detail now, we'll save that for later. There is a first decent clinical trial to show the merits of probiotics. Remind me that we'll come back to probiotics later. And mindfulness is something that I strongly believe in, that many patients in these stressful times of the corona crisis are now resorting to. And mindfulness is beginning to become an evidence-based treatment, but it is still early days. So it's still in that intermediate spectrum of credibility. Now, the second thing is, I'm happy anytime my patient improves. So what I always tell my patients, I prescribe in my clinical practice the types of interventions that are on the right end of the credibility spectrum. But if my patient decides to use something that's more towards the left end, even if that's swimming with whales, and the patient improves, I'm happy. I chose my job to help my patients. And if patients improve, I'm happy. Number 3 is, what do you as the clients really like? And we know from research, this is a Dutch study, that 1 million out of the 17 million people in the Netherlands uses some form of complementary medicine. And this is only the people who admit to it. So even if there is no evidence, you guys are using it. So we physicians should listen. And even when a single patient improves, that is evidence. So this is a beautiful paper about the value of case reports in an evidence-based world. People think that the only way to get evidence is a large randomized clinical trial in hundreds of patients. A single patient improving is not penultimate evidence, but it's evidence. So we should take that serious. And just as an example, there is now very robust evidence for cycling. You may remember the patient that we published about somebody who couldn't walk but ride a bicycle. At the time, this seemed like a little mystery. It started with a single case observation published in the New England Journal of Medicine and is now evidence-based medicine published in large clinical trials. So it starts with a single case. And just to give you a few quick examples, and we'll come to those in a minute. We'll leave the details for the discussion and the questions to Indu, what she thinks. Vitamin E, I know that she has a strong opinion about this, is something that we've tried, proved not to be effective in clinical trials, and in an overdose could actually be toxic. So you need to also be aware of toxicity and side effects. Don't think it doesn't matter if I try it. It could potentially have side effects. Antioxidants like glutathione and coenzyme Q10 hold great promise, have been tried and taken to the test in clinical trials, but were unfortunately not effective. So it's good for you as a patient to know, has it been studied? What was the outcome? Should I spend my money on it and maybe sustain the risk of adverse effects? Here's your coenzyme Q10. And then there is all sorts of supplements that I know many of the patients are using, but that have still been poorly studied. That's not to say it doesn't work. It's just saying that we need better studies. And this one, for example, is widely used, but very poorly studied. And one that I think is really important is cannabis. And I know there are questions about cannabis, so I won't discuss it in further detail here, but leave it to Indu to give her 2 pence when we come to cannabis in a minute. But cannabis is a nice bridge to possible side effects. Cannabis doesn't come for free. It can have side effects. People may become drowsy. It could affect your driving behavior. It could lead to hallucinations or even psychosis. So don't think, oh, let's just try cannabis for the heck of it. It could have side effects. And vitamin B6, for example, is a prime example of something that's very toxic to nerves if you overdose it. So just as an example that even vitamins can have toxic side effects. Manganese, for example, is taken by some patients, very toxic to the brain if you overdose it. So be aware of side effects. Here is sleepiness induced by cannabis as an example. And then one final concern relates to delays in evidence-based treatments. One of them is mucuna, and we'll come to mucuna in a minute, I promise. I will ask Indu about her opinion about mucuna, but I see patients in my clinic nearly every week who only take mucuna, which is by itself, well, we'll come to that in a minute, I promise, but it is unlikely that mucuna therapy alone can treat Parkinson's for many, many years. And I see patients in my clinic severely debilitated, refusing to take regular levodopa, only taking mucuna, and that's not good. So we'll come to mucuna in a minute because it's an important example of the complementary or integrated medicine treatments, and I'll ask Indu her opinion and we'll talk about it. And then finally, regular doctors, quote unquote, my fellow neurologists sometimes say, oh, these integrative medicine doctors, all they do is tell a nice story to the patients. I remember a nice example of a patient who had seen 6 doctors for a particular complaint until an integrative medicine doctor gave her tomatoes with a deep theory about tomatoes, and she improved. Now, that doesn't mean that the tomatoes did the job. It was probably the treatment delivery. It was the careful attention, the rationale behind the treatment, and taking your time and taking your patient seriously. But that is an important part of medicine. And I think if you were to make the division between we and they, then I think that we, as regular doctors, have a lot to learn from them, the integrative medicine doctors, in how to deliver the treatment, in taking your clients seriously and providing a rationale for the treatment. And finally, and this is what Indu and I are hoping to do today, is to guide you folks between hope and hype. When you've got Parkinson's, when your body is failing, you will do anything to get better or to at least improve your symptoms. And I think that sometimes people abuse your despair and your search for hope. And our task, and what Indu and I will do today, is help you to navigate between on the narrow line between hope and hype. I think there is a lot of promise there. There are a lot of treatments in the complementary integrated care realm that could potentially help you. There are also potentially toxic treatments. There are treatments that are not effective and are costing you money. And we're trying to help you navigate in that jungle and divide the line between hope and hype. I will stop it there. And I know there's tons of questions coming in. And by the way, we're reaching 160 participants, which is amazing. Indu, the 2 things that keep popping up, and we'll address them both and start with cannabis. What is your take on cannabis?
Okay, that's a good question and a much asked question. So I think cannabis has some very interesting properties. I think that there's a lot of areas to study in cannabis. I think we know in medicine in general, cannabis can be helpful in pain relief. So, certainly in a hospice, end of life, metastatic cancer, things where we want to, deliver treatment and not worried about the long-term, side effects or even the upfront side effects of somebody having to function on a day-to-day basis. I think we have, roles for that. Certainly it can be an appetite stimulant in these populations as well. So I think certainly I have no problem with, recommending cannabis in this sort of population. In our Parkinson's patients, we're dealing with a neurodegenerative disease that affects cognition. It affects apathy. So that is a lack of motivation. It can affect the mental spheres in terms of causing hallucinations in and of itself and the medications that we use to treat it. So I agree. I think we have to be very careful with prescribing this for motor symptoms, which I think in the short term it can help. So I think we've all seen, sort of a sense that for a short period of time in a tremor or a feeling of, anxiety or things like that. But we have to think about the long-term side effects of this and even the short-term side effects of these sorts of preparations in patients who are set up possibly for side effects in the cognitive and psychotic realms. So I practice currently in California. We have a number of patients who are in age groups where in the 60s they were using cannabis recreationally when they were at a much different age, and then are thinking that this might be a good thing to add to their regimen now in their 70s and 80s, often trying things like edibles and ending up in emergency rooms with psychosis. So I think one of the things that I think we don't have a great sense of is these are not products that are regulated by the FDA. We have no real understanding. I don't know. There's a European, I think, equivalent of the FDA. So these are agencies which regulate what exactly is in a preparation. So we don't have a great sense of what's in there. Even when people are saying that it's pure CBD, cannabidiol, and doesn't have some of the psychoactive preparations of the THC. I don't think we have a great sense of the fact that, these are purely one or the other. And we are not sophisticated enough with the technology and the regulations to know that. I have patients that will say, I went to the dispensary and I got something last week and it really worked for me. This week I went back and I got the same stuff and I feel like it was something totally different. I think we don't have a great way to understand what's in these. And so I would say that it's really important to be mindful of, what we're using these for. There's been a little bit of research in the area of sleep induction, and there's some sense that it may help with sleep. I just saw a meta-analysis paper that just came out by a group, Anastasis, I think is the last name of the last author, looking at all the trials that are out there. There's a number of open label, anecdotal sorts of things that they looked at, and then a number of randomized control trials that were quite small. And really looking at the summation of that data, we don't have great evidence at this time to recommend cannabis for our Parkinson's patients, either for motor symptoms or non-motor symptoms right now. But I think that, this is an area of study that is important to try to get good studies in and to understand ways to study preparations that are very regulated, and that we can feel comfortable feeling like if we went and got this preparation today, that we could, prescribe this across the board and we would have a very set amount of these chemicals in there. And after all, I think we have to understand that even if things are in herbs in a formulation that, we find maybe more natural, there's still quite a lot of potential harm that could be done in some of these situations. And they're very potent in some situations, regardless of if they come in a plant-based form. So I think we have to take these things with caution, but I'm open-minded, but cautiously open-minded.
Right.
And you probably have a lot of experience practicing in the Netherlands. I might ask you your experience as well.
I'll be brief because there's lots and lots of questions and we need to tackle more, but I completely agree with you. It's promising, but poorly studied, potential side effects. I don't prescribe cannabis myself, particularly because the Dutch cannabis is extremely potent. I ask my patients, if they decide to do it themselves, to at least tell me so that I'm well informed. If you take it in the evening, because then the drowsiness helps you to sleep. I think the best indication is sleep, but the best thing people can do is sign up for trials so that we gather further evidence. The next topic.
Before we go to the next topic, just for a second, I think that you bring up something very important. The communication between the patient and the doctor and the various providers is absolutely key. So I think one of the things that I want as a take-home point is to feel that patients can bring what they're doing to their regular trained doctors. Hopefully there can be some dialogue about these, because sometimes there's drug-drug interactions as well that can happen. And so I think from a safety and a communication standpoint, it's really key. And in Holland, it sounds like you have 6% of people doing these sorts of therapies. In the US, some of the recent trial studies have been 60% of patients are doing this. And a lot of them are not discussing these various modalities with their Western regular doctor. So really important to discuss that communication.
Yeah. And just to answer quickly a question that comes in, where are those trials? There's a number of places where you can find information about trials. For example, the Fox Trial Finder, the Michael J. Fox Foundation has a Fox Trial Finder. There's a similar initiative in the Netherlands called Parkinson Next. The Parkinson's Foundation in the United States can provide you information about ongoing studies. So resort to your Parkinson Foundation in your country. The Michael J. Fox Foundation has an excellent trial finder. Probably, Abby, but we can take this offline. We could provide on the website of the endingpd.org website some information about trials. So the next one, and Indu, I know you're passionate, but try to condense it a little bit because we have so many questions coming in. Mucuna pruriens, what is it? Tell that first to the folks, and then should they use it or not?
Yeah, so Mucuna pruriens is a type of broad bean. It's found in certain countries in the world and can be purchased. It has, in some forms, some toxicity, so sometimes has to actually be heated to remove some of the toxic side effects, but it can be found in pill form. My opinion on Mucuna pruriens is that it works better when you give it with carbidopa, and I think, Bas, you did a study on that. It is something that has dopamine in it, and you can look at the equivalent dopamine in Cinemet or carbidopa levodopa preparations in the US, and it has dosing equivalents. I personally think that it gets absorbed quite quickly, and it's hard to regulate the dose. And so it's still dopamine. And so the sense that you're avoiding complications of dopamine therapy by taking it in this natural form is not really an advantage, in my opinion. And I think it's probably going to be harder to figure out the right doses, to, again, not something that's FDA regulated. So very hard to get a sense of, what you're actually putting in your body and what the motor effects are. So I believe personally, and I think even our colleagues like Lori Mishley, who's a close colleague of both Bas and mine, who's a naturopath, really, a lot of these folks who know a lot about Parkinson's are not trying to take people off of their standard Western medications or substitute natural equivalents of these. They're really trying to use things like levodopa, carbidopa in normal preparations where we have standardized equivalents and ways that we can prescribe it. And just to remind people, carbidopa allows levodopa to go into the brain and get used there. If you just take levodopa by itself, it will cause peripheral side effects and can cause low blood pressure, can cause nausea. And so it's really important to combine these two. Because Mucuna doesn't have that carbidopa, it's just like taking levodopa alone and hard, so you get a lot of the side effects without much of the benefit. And so I really do think that in this setting, it doesn't make sense to take dopamine in a way that is through that type of preparation. It would make more sense to take it through carbidopa levodopa as prescribed by your Western neurologist.
Yes, I completely agree. So Mucuna is levodopa. It's the exact same deal as you get from your Cinemet or your Madopar. But it is in one way, it's not a rational treatment because a lot of the levodopa is converted to dopamine in your blood, never enters your brain. If you take Mucuna, combine it with carbidopa, because the carbidopa will make sure that there's more dopamine entering your brain. Even the combination with carbidopa, which is certainly more effective, rarely allows my patients to be on Mucuna treatment only. What I recommend to most of my patients, if they're interested in taking it, is to combine it with regular Cinemet or Madopar, which is interesting because now your carbidopa or benserazide automatically comes with the Cinemet or Madopar. So now it boosts the effect of your Mucuna. So most of my patients combine it with regular medication rather than taking it alone. And I really want to caution against staying disabled unnecessarily for too long by just staying on Mucuna monotherapy. I think that is, you're not doing yourself justice by staying on Mucuna monotherapy for too long. All right, we're going to a completely different treatment now, which is near infrared light therapy. What about that, Indu?
Yeah, so this has become a bit of a hot, sexy thing to try in some of these, saunas and things like that. There's been a few studies in animal models of this type of therapy just at the cellular level. There's been some interest in this in general for wound healing, and there's been a sense that it may be helping with keeping cells happy in neurodegenerative disease. There's really no studies that I'm aware of that have been done in a good fashion to support this type of therapy. And some of these things can be quite expensive. So I wouldn't personally recommend it.
Yep, I completely agree. Somebody urges us to talk about drinking sufficient amounts of water. Now, that's something that I recommend to all of my patients, but Indu, do you want to chime
Sure.
in?
So patients with Parkinson's disease have a few reasons to have low blood pressure. One is that the disease itself affects the autonomic nervous system and can drop blood pressure when you stand up. Additionally, our patients are on medications that can lower blood pressure, like carbidopa, levodopa. Anything that often works with dopamine can lower blood pressure. So absolutely, hydration is very key. It can also help with flushing the kidneys and preventing urine infections and things, which we just talked about. So I tell people to drink at least 40 ounces of water per day, and that's free water if you can. People think that taking things like coffee or sodas or juices are really going to help with that hydration. It's really just water. Anything with caffeine or some of these other things I just mentioned can have diuretic effects, which actually negate adding water to your diet. So just drink regular water or fizzy water. Carbonated water is fine. If you have low blood pressure, sometimes things with electrolytes like Gatorade are helpful.
Yeah, I'd just like to add that one of my patients taught me a very good lesson. He had 2 empty Coca-Cola bottles. It could be any other soda bottle, labeled as 1 and 2. Together, it was half a gallon. Put them in a visible place in the house, and they had to be empty by the end of the day. The incentive to drink diminishes with age, and this is a normal phenomenon. So to have that visual cue to drink half a gallon of true water each day is key for bowel movements, for blood pressure. I know that there was a question about adding salt. When people experience dizziness or the feeling of fainting when they rise, this is a phenomenon called orthostatic hypotension. That is dangerous because it could lead to falls and then fractures or other injuries. It's also an unpleasant feeling, and adding a spoon of extra salt to your diet is one very simple way of treating orthostatic hypotension. Hypertension is the least of your worries. Fainting, falling, and breaking a hip is a big worry. So don't worry about adding a bit of salt to your diet. A quick question about cannabis again by Susan Richards de Wit. We heard that cannabis can cause memory loss temporarily while people are using it. Can you speak to that?
Yeah, I mean, I think that this is something that we see, and when we think of the person who's got a good effect from their cannabis, it's often that they're not sensorially with it. They're often a little bit drowsy and dozing off. So definitely we can see that, and even in certain other populations, cannabis has been seen to help you not temporarily, and even possibly in the long run, it may affect cognition. So I think this is one of the reasons why we're careful with recommending it in certain populations.
Yep. There's an interesting question by Daniel Bowerman, who finds that yoga could bring on tremors when he has a sustained isometric contraction. But on the other hand, there is also some good experience with yoga. So could you speak a little bit about the benefits and adverse effects of yoga?
Sure. So yoga, I think, is a really interesting, form of movement as well as meditation. So there's a few aspects of yoga that I think are really exciting. One is the meditative aspects of yoga. So a lot of yoga includes that mindfulness, being in your body, focusing inward. So you get the benefits of that. And especially if you're not somebody who can just sit in one place and meditate, a lot of yoga is just sort of a bridge towards these experiences. I think very helpful. There's also a lot of focus on the breath. The breath is very powerful on the autonomic nervous system. And I think in my personal experience, this is a really unmet need of studies. We have a lot of interest in how the breath can calm the nervous system down, help with sleep, help with anxiety. And I think this is something that's very exciting to me. And may actually change that autonomic nervous system in a positive way. It can affect the vagus nerve. It can affect different things like even blood pressure and heart rate. The third thing is the asana. So that is the poses The poses are exciting because they allow the body to move. You can actually get your heart rate up quite a lot, so it gets some cardio in. It can get stretching in, which is really important in patients with Parkinson's who develop stiffness and tightness of joints and muscles. And so I think, and it can affect, help with balance, because a lot of it has to do with balance. There's also a beautiful, if you, outside the COVID timeframe, if you go to a class, you have the ability to interact with often a very nice teacher who may guide you and help you, and be one of the treatment team, I think, in some of our patients with Parkinson's that I know really enjoy their interaction with the yoga teacher. And then there's the social interaction of the rest of the class, which I think is very powerful, to experience for Parkinson's patients, because our patients really do need to connect socially in ways. So I think it is a beautiful way to have a number of these effects. I think where the money is for yoga in terms of its benefits is really in the non-motor realm. I think that it can affect anxiety, it can affect depression, it can affect sleep, it can affect so many of these things, cognition. So there's a lot of areas that I think that yoga has, and apathy also may be affected. And we really have very few treatments in a lot of these things. The fact that you get increased tremor when you're in certain isometric holds is not dangerous. It's actually very common. It's as in some patients who may lift weights, you might see that when muscles are agonizing and antagonizing, so one is contracting and one is trying to relax in a posture, and you're holding your posture, that might bring out tremor. And that's actually quite a normal response in the nervous system. It's not to be worried about or dangerous. There's nothing that's going to worsen your Parkinson's disease if you get transient increases in your tremor while you're doing yoga.
Very good. Well, there's more very interesting and relevant questions coming up. I'll take the next one myself, which is about vitamin D levels. It's by Lisa Oei from San Francisco, and she says, bedankt in Dutch, which is very kind of her. So vitamin D I find hugely interesting because there is a sort of metabolic problem in patients with Parkinson's, which makes them more prone to be sustaining a vitamin D deficiency. I'm not saying vitamin D should be suppleted routinely, but I think vitamin D is one of the vitamins that are worth to check routinely and to be supplemented if it is reduced. It is important for bone health, to prevent fractures, and there are anecdotal and fascinating case reports of people taking vitamin D and surprisingly having marked motor improvements. We don't fully understand why. It's anecdotal, it's not robust evidence, but I think vitamin D is among the one vitamins that you need to check and correct. And while we're at it, there is also now some more evidence to suggest that vitamin B, Bernard deficiency, can also occur, maybe in relation to levodopa use. Again, routinely correcting vitamin B is not necessary, but it's also worthwhile to have your vitamin B occasionally checked by your general practitioner and to suplete it if necessary. Anything to add, Indu, here?
No, I agree. And vitamin D in general is deficient even in sunny environments. So I would definitely check it. I think once a year is reasonable. And certain people would recommend actually replacing it up into the above 40 range in our ranges. So that's actually quite high in the ranges. So not just keeping it at the low range of normal, but actually replacing it up into the higher range. And I agree, bone health and even other areas of Parkinson's can definitely benefit from higher vitamin D levels. And vitamin B12 can actually cause memory issues and things. So absolutely check B12 as well.
Yep, very good. So the next question is a very important one. I will also add my own thoughts here and then ask you to add into. It's by Dietrich Borchardt, suggests a German background. He says, I try to avoid classical medication as long as possible, mainly side effects, and do a lot of sports as well as a bit of yoga, change nutrition and mindset. What is your opinion when to start levodopa or another classical treatment, as early or as late as possible? I can tell you that I have a very strong opinion about this. As you can tell, both Indu and I are very open-minded to holistic approaches and integrated medicine. Very open-minded. At the same time, I think postponing symptomatic Parkinson medication unnecessarily long is really not doing justice to yourself. And now fasten your seatbelts and listen carefully. What I tell all my patients is the time to start medication is when your work becomes difficult because of your Parkinson's, when your hobbies become difficult because of your Parkinson's, when your mobility is affected, your ability to go from A to B without cumbersome problems or insecurity, and 4, when activities of daily living become cumbersome, like dressing, eating your food. If one of the 4 is hampered to an extent where it annoys you, don't hesitate, start treatment. There are now a number of trials, including a big one in the New England Journal of Medicine, where I was an author, where we randomized people with very early Parkinson's to either a fake pill or levodopa, and we followed people for a long period of time. The groups were identical after 18 months, so there were no long-term side effects, but the group who started early had a much better quality of life, was able to move better, was thereby able to exercise more, and exercise itself is hugely important for you guys. So if your Parkinson's is mild, you can do anything that's important to you, there's no need to start treatment. But the moment one of those 4 domains becomes iffy, no ifs, ands, or buts, start with the treatment. And it could be a combo of maybe mucuna and regular levodopa, but don't be afraid of regular medication. It helps you, it probably supports your brain. Indu.
Yeah, so I agree. I think that to add to your 4, I think you mentioned mobility as one. I would say the 5th and maybe even the 1st, actually, if we go back to and reorder it, it would be affecting your exercise. So I personally think I like to get my patients exercising right out the gate. I make a diagnosis. That's why I think we need to be looking for possible premotor indicators, is to get a population of patients who look like they might be heading into Parkinson's, getting them exercising on a vigorous realm. I think exercise makes a huge difference. I would almost say if you can't exercise in a robust way, and I have patients who, are trying to exercise because they know it's good for their brain, and I think we show that in evidence, but then they're hampered because one side of their body is not moving very well, their foot is cramping, something else is happening, and you can actually injure yourself pretty badly with asymmetric movement of untreated Parkinson's with aggressive exercise. So I don't personally think that sparing levodopa is a smart thing. I am not necessarily substituting. I really don't tell people to use mucuna here. I really am saying if we are seeing stiffness and slowness in the right population, let's use dopaminergic therapy to treat you so that you can exercise at your top of your game. And we have patients, once we start this combo treatment of exercise and Cinemed or whatever it is, are really feeling actually much better and are in better state of health with Parkinson's than they ever were before they got the diagnosis. And that's part of the empowerment. I'm seeing words about empowerment here. It's really about, using your own motivation, your own innate body's healing response, along with replacing dopamine to heal yourself.
I completely agree. There's an important, this one can be addressed briefly by Mark van Gieken, who is Dutch by origin. I know that for a fact. And he asks about possibly negative interactions between supplements and what the patient eats. Any evidence there? I don't think so.
Not in general. I mean, I think that if you're able to get good vitamin levels through a very healthy, balanced diet, it's always better to get these sort of vitamins and things in their natural form. And when we think about systems like Ayurveda or even traditional Chinese medicines, a lot of these systems were created where you're using something like curcumin, for example, which you mentioned, in ghee, which is, a fat. You're cooking curry with ginger and cumin and black pepper and a lot of these things in a curry, and it actually absorbs in a very beautiful way to get to the brain in a different way than we could ever get in a pill form. So I think if you can use ways, and I know you had folks on talking about the Mediterranean diet, which is what I largely recommend, whole food, plant-based largely, that's sort of what I try to recommend. And then looking for vitamin deficiencies and definitely replacing those with pills would be the way that I would kind of approach it. I'm not really about eating garbage all day long and then taking a bunch of pills off of a shelf.
Excellent. Tamara Watkins, thank you for joining. Tamara has an important question. There are many versions of probiotics. Which one do you recommend? And I might add myself, if any.
So I think probiotics are quite controversial. I think you talked a little bit about this on a previous video in this series. So I might, not to take a lot of time here. A lot of what we're talking about now is prebiotics. So looking at things that have a lot of fiber, the allium vegetables, and onions, things like that, that have the ability for your own gut's natural bacteria to thrive in order to get sort of a better environment in which you can really sort of be thriving. So I don't necessarily prescribe a lot of probiotics per se. I think you can get yogurt cultures. I think somebody asked about curds and stuff like that. A lot of those things are actually very good for our gut through a natural dietary process. And so I would really recommend prebiotics and possibly, things like curds and yogurt and things like that that have a good amount of bacterial culture.
So the curd question has also been answered by Dr. Malhotra. I'd like to add myself that there's now one study in JAMA Neurology to show some benefits of probiotics. It could help for constipation. It could help change the bacterial constitution of the gut in the right direction. But there are also concerns that some probiotics might change it for the worse. So I still think probiotics is early days, and the honest answer to my mind is that we really need better evidence and more treatments. So to blindly take probiotics, carefully monitor your symptoms. Things might also turn out for the worse, and if it does, consider stopping the probiotic. There's a tip by Bev Ribaudo. Thanks, Bev, for helping us out here. She says sublingual vitamin D drops are absorbed more easily than huge tablets. That's a great recommendation. An anonymous attendee, welcome nevertheless, of course, thank you for joining, says, is dry needling effective for pain caused by rigidity? Indu.
I think that it can transiently help. I think that, again, stretching is probably better in general than dry needling and things like that. Massage also may help in general, especially if you have a partner in your life that can do it on a regular basis. If you have tightness, to use massage pre and post, exercise can be helpful as well. But I think, a lot of these things may make you feel better for an hour or two after, but there's not a lot of evidence that they help in the long run. And certainly may be expensive.
Yeah. The next question is by Mohammed Fayaz. Welcome, Mohammed. I'll answer this question myself first. Recently, we have recommended for stem cell therapy by a neurologist for treatment of MSA, multiple system atrophy, in his mother. What is my idea? Well, stem cell therapy is a way of bringing a package of very young immature cells into the brain that have the capacity of becoming a little dopamine factory in the brain and thereby delivering dopamine more efficiently right into the brain. In that regard, it is just like oral pills, but just another way of delivering a package of dopamine into your brain. The honest answer is, Mohammed, and to all your folks, that it is still a very scientific, experimental treatment. There have been studies which have been disappointing, that came with unexpected side effects. And I think it is a promising treatment. Professor Roger Barker in Cambridge in England is doing state-of-the-art research trying to bring it to the next level, and I think he will do it. I think that during my lifetime, we will see stem cells coming back as a treatment for Parkinson's. Today, it's experimental. Don't sign up for a treatment if somebody tries to sell it to you. There are crooks, criminals out there that try to sell stem cells to you folks. Don't buy them. Don't buy them. If you're interested in stem cells, sign up for a clinical trial by a respected international center. Anything to add there, Indu?
Yeah, I agree.
Yeah. Let's see. What about mindfulness? Can you add a little bit there?
Sure. So mindfulness, people think that mindfulness is something very new and novel. It's just a way, it's a term that's used for a type of meditation. And largely, I think meditation is a really fascinating area in the neurodegenerative spectrum or in the brain disease spectrum, because basically what it does is have you focus your attention in a non-judgmental way, sort of internally. And so you're really just thinking, having the attention outside be focused internally, and you're sort of looking at the thoughts that come into your mind, noticing them and allowing them to pass. And so it's really just sort of clearing the mind of these thoughts. And what a lot of us are seeing, especially in this COVID timeframe, is that when you think about the thoughts that are in your head, it's the same 5 thoughts probably that occupy 99% of your time frame and energy. And a lot of this, once you notice these thoughts and what's entering your brain, it helps you to get a sense of how to control these thoughts and to allow your mind to just rest and relax a little bit, which I think is a very helpful sort of strategy to tackling a lot of the non-motor issues that come up in Parkinson's. So things like anxiety, things like depression, insomnia. Once we are able to sort of focus the mind, and this is not an easy thing. It's not like you're going to go from never having tried this to being able to sit and meditate for an hour. There's sort of small bite-sized ways to try this. I ended up doing this course called Mindfulness-Based Stress Reduction, which was very helpful to me, largely for healthcare providers. And it started in a philosophy started by John Kabat-Zinn, who's a meditator and an MD, a Western trained doctor, who looked at these sort of applications of meditation to see if it could help diseases or disorders of Western, sort of patients in Massachusetts back in the 70s. And what we've seen is that these use of meditation can be very powerful for a number of different disorders. There's a lot of data on depression, anxiety, pain, sleep disorders, things like that outside of Parkinson's. And I think we can use this, and it's a very safe modality, in my opinion, that can be very transportable and cheap and free. We have a lot of apps and things that we can try. And so I would definitely encourage people to do these.
Yeah, I'll take a few questions quickly myself because we're approaching the hour. Jane Collar says, I use mucuna as a rescue remedy to push my Stalevo. I would never use mucuna as a rescue medication. Mucuna, as we pointed out, is a relatively weak dopaminergic agent. What I do, if people need rescue medication, I use dispersible Metapar, which is you can dissolve it into water and dissolve it into sparkling mineral water, which tends to boost the efficacy of the levodopa as a rescue medication, or apomorphine injections if you're in a country where apomorphine injections are prescribed. Mucuna as a rescue is not a good idea. Mucuna is an add-on treatment that will mildly boost the overall efficacy of the treatment, but don't use it as a rescue medication. And maybe the final question for you, Indu, before we close is by Amy Lindberg. Can we test and clear metals and toxins to help our Parkinson's? And how can we test for this? Does it make any sense to do that?
Yeah, I mean, there's a lot of interest in testing. Generally, testing of metals and things like that and toxins have been through hair analysis. I don't personally do these sorts of studies myself. And I don't find there's been studies on looking at chelation to try to clear metals. I personally don't think that these are effective or useful ways to spend our time as individual patients. I think that the better precedent to sort of push is to try to prevent these toxins from being in the environment in the first place. And so I will liaison this all the way back to you, Bas, and your efforts with the Ending Parkinson's book and the call to action that you've talked about, and the pact that is to try to decrease these toxins in the environment in general. I will say on an individual basis, trying to eat healthy, organic food if you can, trying to do your best to be well in terms of all of the aspects of, mind-body approaches. We talked about meditation, things like exercise, things like sleep, things like eating right with lots of fresh fruits and vegetables, whole food, plant-based, hydration. All of these things are a prescription for wellness and lifestyle. Social connection is very key. I think that would be my take home of this, and not spending a lot of time on these things like hair analysis and other things.
Yes, I completely agree. And that also answers another question, whether natural pesticides in vegetables can cause leaky gut or irritation. I don't think there's such a thing as a natural pesticide. These are, of course, toxic chemicals that we put in our environment. And I also want to echo what you said. If you can afford it, consider organic food. Try to avoid too much dairy products, which probably also contain or can contain measurable amounts of pesticides. But you do need to take some proteins to avoid, weight loss and to keep up your muscle strength and muscle power. I know we haven't reached or been able to address all the questions, but we've had an amazing turn up. Because this is such a lively topic, I can probably see us doing another round.
Absolutely.
Of Integrative. You would be open for that?
Totally.
Indu?
Anytime. We could do this weekly. I'm down. And it'll be fun to watch your hair grow, Bas. I think it'll be fun through COVID to, just reconnect.
Like coop COVID. I want to thank the audience for joining. Apologies if we haven't addressed everything, but I promise that we'll get back to you with a new seminar. Just to remind folks that there will be a new seminar in the Ending PD series on Wednesday, May 27th at 1 p.m. Eastern time. And this is Michael Oken, my good friend and colleague from Florida. But lo and behold, Lonnie Ali, the wife of Muhammad Ali, who sadly, of course, passed away with Parkinson's, she's going to join that show. And they're going to talk about caregiver issues. So highly recommended, Wednesday the 27th at 1 p.m. Eastern, Lonnie Ali together with Michael Oken. Thank you all for joining. I hope it was helpful. Do provide us with your feedback. We want to improve our services to you in this time and era of the Corona crisis. And I hope to see many of you soon again with our next webinar. And thanks and a big round of applause for Indu, who did an amazing job. Thank you, Indu.